Okay, I'm going to show you how to assess a patient who has an NG tube in place. So first we've identified our patient and we've done our hand hygiene, and now I'm going to assess the NG component. So when I'm doing this, I'm starting off by taking an observation of the patient, and I'm looking at the insertion site of the NG tube. I'm looking at the nair to look for any skin breakdown. I'm also making sure that the tape holding the NG tube in is intact and holding it down. I'm also looking at the markings on the NG tube. When the nurse inserted the NG tube, he or she would have documented how many lines were on the NG tube outside of the body. So you want to make sure that you have the same amount of lines outside the body here. So this one is 3 lines outside of the nose, and that's what should have been documented upon insertion. So we're going to assess the skin for breakdown, the location of the NG tube. Next, I want to assess for the position inside the stomach. So at this point, I want to shut my suction off, and I want to check for gastric secretions. So I'm going to kind of close my NG tube so that nothing comes out at me. Insert my syringe, and I'm going to pull back, and I'm looking for an aspirate or the gastric secretions. And that way I know that I am in place, my NG is in my stomach. If I get any gastric secretions, I will then inject that back into the patient's stomach. At this point, if there is a physician's order or the hospital policy, you may flush the NG tube, perhaps with 30 mLs of water or whatever is ordered by the physician. Okay, so I'm going to close that NG tube back off and connect my suction back on. Okay, the next thing that you want to assess is the patient's bowel sounds. When you assess a patient's bowel sounds with an NG tube in, the suction needs to be shut off. So if there is suction on, please make sure you shut your suction off before going to listen to the abdomen. So at this point you would pull out the patient's gown, you're inspecting the abdomen, you're looking for the contour, is there any distension? Then I'm going to auscultate the bowel sounds, again remembering that your suction is shut off. So you would auscultate in all 4 quadrants of the abdomen, listening for bowel sounds. And then after you have listened to your bowel sounds, you can then palpate the abdomen for any tenderness. Once you are done inspecting, auscultating, and palpating, you would then come back and turn your suction back on to either regular or intermittent, depending on what is ordered by the physician. You would also want to make sure that your NG tube is connected to the patient gown. You can place a piece of tape around here and then safety pin it to the patient's gown. You don't want it to accidentally get pulled down on the skin, which can then cause breakdown on the nair. So you want to make sure that it's nice and secure to the patient gown. And that is how you would assess a patient who has an NG tube.